years ago, the hospital identified several areas where we wanted to strategically focus our efforts and our resources. One of those was the joint replacement program, knowing that as the population ages, joint replacement surgery continues to be a viable option for our patients to have good outcomes and be returned to normal function in their life. So we wanted to put a lot of resources into making sure that when the patients come here and make the decision to have their joint replacement at Duke Regional Hospital, they're going to have the best outcomes and a safe discharge from our program.
Hi, my name is Bethany. I'm a nurse at Duke Regional Hospital on the orthopedics floor, and I represent part of your care team. Your care team involves you primarily, and your nurses, your doctors, your physical and occupational therapists, as well as your social workers or discharge planners. And our goal with this class is to make you feel involved in your care, like you know what's going to happen, and to decrease your anxiety level. And ultimately, to get you moving again. Why are you having this joint replaced? What kinds of activities do you want to get back doing?
I want to go hiking again.
Hiking,
I want to be able to play with my grandchildren.
playing with the grandkids.
Climbing stairs.
All right, there you go.
I'd like to play golf again.
All of those are things that you can do once you have your joint replaced. The number one question that we get from people is, when do I get to leave the hospital? Most of our patients, the day of surgery is called post-op day 0. Post-op day 1 is the following day when we do a lot of work on your mobility and your pain control. And a majority of our patients will have a chance to go home on post-op day 2. So if your surgery is on a Monday, that would be on a Wednesday. If we need to keep you until post-op day 3, that's okay too. So that would be if you had your surgery on a Monday, you would go home on a Thursday. The next question would be, where do you go when you leave the hospital? All of our patients will go to one of 3 places. The majority usually go home. We like to send about 75% of our patients home. The other section will go either to a subacute or an acute rehab facility. A subacute rehab facility is the wing of a nursing home that's devoted solely to rehab. You may go there for a week to 2 weeks, depending on how much extra therapy you need, before you then go home. An acute rehab facility is where you are required to do 3 hours a day of physical therapy, and you require 24-hour nursing care. Most of you will not qualify to go to an acute rehab facility because you're mostly healthy outside of your joint that we've replaced. But a subacute rehab facility may be an option for you. In your folders, there's the Forward Motion Discharge Planning Guide. It looks like this. If you wouldn't mind filling that out for me, or you can also find it on our Forward Motion page of our website. This just helps us anticipate kind of what you will need when you leave us, either home, subacute, or acute rehab, based on several factors, such as how mobile you already are and how much help you'll have available to you after you leave us. The next thing we're going to talk about is pain control. In your folders, there's also a piece of paper that says Pain Rating Scale, and I'd like you to take a look at it and think about this question. Most of you are having this surgery because you're already having some pain on a daily basis. The pain that you're having right now is a chronic pain. This means it will get worse as time goes by. And you will have some pain after your surgery, but it will be acute pain, and it will get better as time goes by. We'll ask you while you're here many times, how would you rank your pain on a scale of 0 to 10? 0 is no pain, and 10 is the most severe pain that you can imagine. Now, there's no right or wrong answer to this question. It's completely subjective. So whatever you think your pain is, that's what it is. So are any of you in pain right now?
Yes.
How would you rank your pain on a scale of 0 to 10?
About a 5.
About a 5. And did you take anything for that pain this morning?
Yes.
And how would you rank your pain before you had the pain medicine?
It was about a 7.
A 7. So that is a very accurate description of how pain medicine works. Your pain may be like a 7 or an 8, and then you take the pain medicine, and it comes down a couple of notches. The main reason we ask you this question so many times is to try and keep your pain under control. It's much easier to keep your pain under control than it is to let it get to a 10 out of 10 and then try and wrangle it under control. We have several modalities for pain control, the first being oral pain medicine. Our favorites are Percocet, oxycodone, and Vicodin, but if you already take something that works very well for you, just make sure that we know about it so we can continue to give it to you after your surgery. In addition to oral pain medicine, our surgeons allow us to use IV pain medicine. This goes in your system very quickly, but it doesn't stay in your system for very long. So that's why we would prefer to use the oral pain medicine. We also like to use ice. Ice is a great modality for pain control. It will help kind of numb the area of surgery, and it also can help reduce swelling and bleeding. Our knee replacement patients may have something called a polar ice machine. The polar ice machine looks like this. It's a cooler that has ice and water in it, and it's connected to a pad that will be wrapped around your knee. This puts out a constant stream of ice water that will help numb and control bleeding and swelling. The knee replacement patients get this because it wraps around your knee very well, but our hip replacement patients we can still use traditional ice packs for. Our knee replacement patients may also have something called a femoral nerve block. A femoral nerve block looks like this. It's a ball filled with medication that numbs your leg that's inserted by an anesthesiologist into your groin here, and it covers your femoral nerve. This constant stream of numbing medication only covers the front half of your leg, however, so you may still have some pain in the rear of your leg. This is great. You keep it for usually about 2 days, and then it comes out. For the majority of the time that you have this, if you're going to be getting out of bed, you're also going to need a knee immobilizer. This is what a knee immobilizer looks like, and it has metal stays in it that just prevent your knee from buckling underneath you. If you're out of bed and you have a femoral nerve block, then you're probably going to need to wear one of these, but past the time when it comes out, you won't need any type of brace. So as you can see, we use many different methods to control your pain, and it's very important that we do this so that you can participate in your physical therapy. We want to try and keep your pain manageable, but we can't make it go away altogether. Pain medicine has this nasty side effect of causing constipation. There's no way to completely avoid it, but there are things we can do to prevent it. You can help us by drinking lots of fluids and making sure to be actively participating in your physical therapy. And even when your physical therapists are not in the room, make sure that you're moving around as much as possible. Since these things are not going to prevent constipation altogether, we will also give you stool softeners and laxatives while you're here in the hospital. You should be passing gas by post-op day 2, and if you're not, please let your nurse know so that we can give you something else to help with that. The next thing that we're going to talk about is preventing surgical site infections. Before you have your surgery, you'll go to a pre-op appointment where they'll give you something called Betasept. It looks like this. This is a CHG scrub, and it helps decrease the number of microorganisms on your skin. We ask that you take a shower with this the night before your surgery and scrub with it like a body wash from your chin down to your toes. It's good to avoid your private areas, though. That skin's a little sensitive for this. If possible, if you could take a second shower with it the day of your surgery, that will just be even more beneficial. After showering with the CHG product, please get into clean pajamas and clean sheets. You don't want to reintroduce any bacteria onto your clean skin. The day of your surgery, when you come to the pre-op holding area, we will scrub you again with another CHG product. And then once you go back to the OR, we'll scrub you again. This is all to make sure that we don't have any microorganisms on your skin when they make that first incision. While you're here, we'll also be giving you IV antibiotics. You'll get your first dose in the OR right before they make that first incision, and then you'll get subsequent doses in the first 24 hours. How many you get depends on the type of medication that's ordered for you, and you may not even know that you're getting them, but rest assured we will be giving them to you. We also ask that you don't shave for at least 3 days before your surgery. Shaving can create little micro nicks in the skin that can harbor bacteria. If a leg is very hairy, we can clip it with surgical clippers, but we don't use any razors. It's also important that if anyone is touching you, they should have washed their hands. Outside of each room is some antibacterial hand foam. It looks like this. We also have antibacterial hand gel, or a nurse or a doctor can just wash their hands with soap and water, but it is very important that anyone who's touching you should have washed their hands. If you don't see your caregiver wash their hands, feel free to ask them to do so. No one will take it personally, and it's very important that they do so to prevent infection. The next thing that we're going to talk about is preventing blood clots. Anyone who's had surgery has a risk for developing a blood clot, but there's several things that we do to try and prevent this from happening. The first is that anytime you're in bed, we're going to ask that you wear SCDs. SCDs look like this. They're wrapped around your calf, and they help prevent blood clots. This section at the back will pump up with air that will help push blood back towards your heart. It's like a little calf massage. Now, these do make a little bit of noise, so sometimes they irritate people, but it's very important that you wear them anytime you're in bed while you're here. In addition to the SCDs, we'll also use some type of blood thinner. One that our doctors like is Lovenox. Lovenox is a little shot that you will be given once a day for about 2 weeks. If this is something that your doctor orders for you, we'll teach you how to use it so that you know what to do. Our doctors may also order an oral anticoagulant. This could be aspirin, Xarelto, or Coumadin, depending on your history and your physician's preference. It's important that you take these things as we order them for you so that you don't develop a blood clot.
There are a lot of programs available through our state for patients to choose from to have a joint replacement surgery. And we feel like the best choice for our patients is to come to Duke Regional Hospital, again, because we have achieved that Center of Excellence status with a national accreditation body. We've made lots of strides to make sure that every aspect of our program provides that patient with the best experience. All of our disciplines are involved, all of our entities from respiratory therapy, physical therapy, the OR team, our physicians, our nursing staff are all engaged in making sure that the patient's choice to come here will be proven to be a safe and wonderful experience when they leave.
The day before your surgery, or if your surgery is on a Monday, the Friday before your surgery, you'll get a phone call from the hospital telling you what time we need you here on the day of your surgery. If you don't hear from us by 5 p.m., please call the hospital operator and ask for the OR charge nurse so that we can tell you what time to be here the day of your surgery. There's several things we'd like you to bring and several things we don't want you to bring. If you have any toiletries that you absolutely love and can't live without, please bring those. We have soap and lotion here, but they're very generic versions of those things, so if you have something that you love, make sure to bring it. Please bring any eyeglasses, hearing aids, or dentures that you might need. You won't be able to wear those during your surgery, but you'll probably want them immediately afterwards, so if you could have your family member keep them in the waiting area, that would be great. We also suggest that you bring a change of clothes for the day that you go home. While you're here in the hospital, you'll be connected to several different tubes and lines, so you'll be wearing a hospital gown for the majority of your stay, but you will need a change of clothes for the day you go home. My suggestion would be to bring some pants that have a loose elastic waist that could easily fit over dressing, some shoes that have a back but no laces, like a loafer, that you can easily get in and out of, and some loose fitting tops. It's important that you don't bring any valuables with you. We don't have any place to keep those, and you will have pain medicine on board, so you won't remember everyone who's in and out of your room. It is okay to bring cell phones and laptops. We do have free Wi-Fi here in the hospital, but just make sure that you don't leave them unattended in your room. It's best to bring those things if you have a family member who's willing to take responsibility for that. It is okay to bring books and magazines and crossword puzzles. Each of our rooms has a television in it that you will also have at your disposal. However, you're not going to have as much free time as you think you might. We only have 2 or 3 days with you, and we have a lot to cram into those 2 or 3 days. We don't want you to bring any of your medications on the day of your surgery. Anything that we are going to give you, we will give to you out of our pharmacy. Unless your doctor or nurse specifically asks you to bring in a medication, please leave all of that at home. While you're here, please don't get out of bed without staff assistance. Anyone who's had this type of surgery is at an increased risk for a fall. In each of your rooms, you'll see a sign that looks like this. It says, "Caution, call, don't fall." That means we want you to call for staff assistance before trying to get out of the bed, and we don't want you to get up by yourself. Family members don't count as help because they're not equipped to dealing with all of the equipment that you'll have. We really prefer that you have a staff member with you. In your pre-op holding area, you'll be given some yellow socks and a yellow wristband. They look like this. The yellow wristband says falls risk, and the yellow socks will help identify you to staff in the hospital as a falls risk to say that if you're getting out of bed, we'd really prefer to be with you. Does anyone have any questions?
Driving an automobile. When can I drive my automobile?
That's really determined by a number of factors, such as whether you had your left or your right leg operated on, but you certainly shouldn't drive as long as you're on narcotic pain medicine, and definitely at least until your follow-up appointment with your doctor.
Can someone stay over with me in the hospital?
Yes, you can have one adult family member stay overnight with you. Each room is private and has a recliner that folds down into a bed.